Welcome to Learn Medical Spanish. So this is the second video or podcast about internal medicine, or in other words, primary care. And today we're going to be covering some phrases related to blood pressure, cholesterol, and UTI. So these phrases came from a listener. He gave me the English phrases, and I just made a few adjustments and then translated them. So hopefully they're helpful because he works in internal medicine. All right, so I'm going to say the phrases in English as usual, and then I'll pause long enough for you to think about the translation. And then I'll say them a couple times in Spanish and give you time to repeat them out loud after me each time. All right, so here we go. So we're going to start with blood pressure. So here are some phrases related to blood pressure. And the first one is, your blood pressure is high. So think about that translation. Your blood pressure is high. Su presión de sangre está alta. Su presión de sangre está alta. Do you have a home blood pressure cuff? ¿Tiene un manguito de presión arterial? ¿Tiene un manguito de presión arterial? So the word arterial is in parentheses because you could leave it out and probably still make sense. Usually I have both the English and the Spanish with something in parentheses, but this time it's just on the Spanish side. Okay, next phrase. You need to lose weight and exercise to improve your blood pressure. Necesita bajar de peso y hacer ejercicios para mejorar su presión de sangre. Necesita bajar de peso y hacer ejercicios para mejorar su presión de sangre. So that was kind of a long one. Hopefully you could kind of follow along. Here's the next phrase. I would like to give you a medication for blood pressure. Quisiera darle un medicamento para la presión de sangre. Quisiera darle un medicamento para la presión de sangre. I see that you're taking a diuretic. Veo que está tomando una pastilla diurética. Veo que está tomando una pastilla diurética. Two quick things there. I don't know exactly why he included this phrase, but he's been working in internal medicine for many years, so I guess that comes up sometimes, that you would want to mention that or something when you're talking about blood pressure. And the other thing is I put an asterisk on diurética because obviously that is... it seems obvious that it's medical jargon in Spanish as well, so people may not know what it means, so you could be the one to explain it or not, depending on the situation. So if you had to explain it, you might say, es la pastilla que le hace orinar más. It's the pill that makes you pee more, or something like that, as an example. So just FYI, that I'm aware that's jargon, and you may or may not need to explain it, but I didn't really specifically address how to explain that in layman's terminology other than what I just mentioned a moment ago. All right, moving on. So that was our little kind of simplified dialogue about high blood pressure, and now we're getting into cholesterol. So the first phrase for this is, your cholesterol is too high. Su colesterol está demasiado alto. Su colesterol está demasiado alto. So again, in parentheses there, if you're just listening, the word demasiado and the English version, TOO, are in parentheses because you could probably leave that out, but it just depends on how much you want to emphasize that it's too high and not just high. All right, next phrase. This increases the risk of heart attack and stroke. Esto aumenta su riesgo de ataques del corazón y derrames cerebrales. Esto aumenta su riesgo de ataques del corazón y derrames cerebrales. Quick note on derrames cerebrales. So that's kind of the most common phrase for stroke, but it's not really accurate because it means a brain bleeding in the brain. So if you're talking about an ischemic stroke, it's not the same thing, of course, but that's just the phrase that they use the most. Another one is embolio, which sounds like embolism, so that's also not necessarily quite accurate if you're talking about an ischemic stroke. But if they've lived in the United States for a long time, you might be able to just say stroke, or stroke. You could give it a little bit of a Spanish pronunciation and just say the word stroke, maybe, just like MRI. MRI is what they would understand more easily if they've been in the U.S. for a long time, typically, but not always, right? So every situation is a little different. All right, moving on with some more cholesterol phrases. The next one is, you also have your triglycerides elevated. También tiene sus triglicéridos altos. También tiene sus triglicéridos altos. So triglycerides, another jargony word that people may or may not be familiar with. So I put an asterisk there, and you could explain that in Spanish if you needed to by saying something like, es una forma de grasa en la sangre. It's a form of fat in the blood, for example. Something like that. All right, next. I am prescribing 1 pill daily to lower your cholesterol. Estoy recetando una pastilla diaria para bajar su colesterol. Estoy recetando una pastilla diaria para bajar su colesterol. The next phrase is a continuation of that same sentence, and that's why it says, and decrease your risk of heart attack and stroke. Y disminuir su riesgo de ataques del corazón y derrames cerebrales. Y disminuir su riesgo de ataques del corazón y derrames cerebrales. So that's a mouthful, and we already talked about that phrase, derrames cerebrales, so that's one way to say stroke and the alternatives and stuff. But that is kind of a mouthful, a lot of things that are a little tricky to pronounce there. So if you want to say it that way, you'll have to practice a little bit probably. There are some different synonyms you could kind of replace that with, but moving on. Okay, so that was the little dialogue about cholesterol and things you might want to say in a primary care clinic about cholesterol. And then next we're getting into UTI. Now I've done a video on UTI, but these phrases, the wording is going to be a little different here because it was written by somebody else who works in internal medicine. So hopefully it'll be useful to kind of see a little bit different way of talking about it. Okay, first phrase. Do you have burning on urination? ¿Le arde cuando orina? ¿Le arde cuando orina? That means, does it burn when you pee? So phrased a little bit differently. Next phrase. Do you have any flank pain? ¿Tiene dolor en el costado? ¿Tiene dolor en el costado? Do you have any fever? ¿Tiene alguna fiebre? ¿Tiene alguna fiebre? So just like English, that's maybe a little ambiguous about the time frame that you're talking about or whatever. Like, do you have any fever? But that's how he wrote it in English, so I went with it. All right, next phrase. Do you have vaginal discharge? ¿Tiene flujo vaginal? ¿Tiene flujo vaginal? So that's the word vaginal. You could also say de la vagina, from the vagina or whatever, if you want to change that a little bit. All right, next is, do you have a history of urinary tract infections? ¿Ha tenido infecciones urinarias en el pasado? ¿Ha tenido infecciones urinarias en el pasado? So again, we changed the phrasing a little bit because we didn't say a history of, because that might be awkward to say in Spanish. So we just said, have you had urinary infections in the past? I am going to prescribe an antibiotic. Le voy a recetar un antibiótico. Le voy a recetar un antibiótico. You should take the antibiotic twice daily for 3 days. Debe tomar el antibiótico 2 veces al día por 3 días. Debe tomar el antibiótico 2 veces al día por 3 días. And obviously you could adjust that and say 3 times a day for 7 days or whatever it's going to be, right? 3 veces al día por 7 días, as an example. Okay, so that kind of concludes the UTI part. And then a couple quick party notes. So if you haven't already checked them out, check out my 5 focused beginner lessons, especially high yield for providers, at learnmedicalspanish.org/lessons. And I'll put a link below in the podcast or on YouTube. And then if you're on YouTube, I've got a couple really useful playlists for you here, if you haven't already checked them out, with a bunch of other medical Spanish dialogues and one that's very high-yield beginner or basic Spanish as well. And if you're on the podcast, you can just kind of scroll down and check all that stuff out. Thanks for listening or watching, and I'll see you next time on Learn Medical Spanish.